Welcome to Muscle Research Review for the week of June the 8th, 2015. Quick research summaries for the very busy health and fitness professional. This week, we're going to go into focusing more on the current low back pain research. So let's begin. Do you perform the straight leg raise test as part of your examination for possible disc herniation? There's some debate on the effectiveness of this test lately, with the results being varied. A new study looked at the effective age on result of straight leg raise tests in patients suffering from lumbar disc herniation and sciatica. They found that there was an increase in negative straight leg raise results in the elderly compared to younger patients. Results are important in understanding the use of the straight leg raise in different age groups. Now, putting it into practice, straight leg raise may be weighed less and imaging more. The prone hip extension is commonly used in assessing stability of the lumbopelvic region. But is there a difference in timing of the trunk and hip extensor muscles? A new study looked just at that. Results showed that the onset of bilateral multifidus and contralateral erector spinae was significantly delayed in the chronic low back group compared to the healthy group. Now, surprisingly, the glute max and the ipsilateral erector spinae showed no difference. The study shows that there may be inadequate trunk muscle recruitment patterns due to chronic low back pain. Future studies should look at whether addressing this has any effect on the pain itself. Now, we go from altered muscle recruitment patterns in the low back to prevalence of gluteus medius weakness in people with chronic low back pain compared to healthy controls. Now, this new study looked at hip abductor weakness in 150 patients compared to 75 control subjects. The study found that the gluteus medius is weaker in those with low back pain, in addition to more palpation tenderness over the glutes, greater trochanter, and the paraspinals. Putting it into practice, identifying trigger points and strengthening the gluteus medius may be something to look at when treating chronic non-specific low back pain. Ever wonder why certain patients or clients respond differently to the same treatment? A great new study applied this to spinal manipulation. More specifically, they asked the question, do participants with low back pain who respond to spinal manipulation differ biomechanically from non-responders, untreated, or asymptomatic controls? Responders were those that had improved self-reported disability after the 7-day trial. Treatments were provided over 2 sessions. Now, the spinal manipulation responders displayed statistically significant decreases in spinal stiffness and increases in multifidus thickness ratio over the 7 days. The spinal manipulation responders also had significant post-spinal manipulation improvement in apparent diffusion coefficients of the lumbar discs, which is a measure of the magnitude of diffusion of water molecules within the tissue. The non-responders had no changes in any of these parameters. The study really demonstrates how varied our response to treatments are. There's been a trend towards personalized medicine these days. However, studies like this should stress how important that personalization can be for rehabilitation and performance. If you have any comments, leave them below. Make sure you subscribe to our YouTube channel for the latest muscle research. See you guys next time.